fever is one of the most common reasons for visiting the ER. Fever is associated with many, many, many conditions, but many and the people not they do not go because of the conditions they have. They go because of the fever, which is actually not the way it should be. But I guess we grew up with a certain fear of fever. So fever almost never is a condition by itself. So it's always like a way for other condition to manifest, or at least that the body is fighting against an infection. But if you have 3 or more days of fever, and I'm very it's very important for you to take the temperature with a with the device you like, oral or axillary temperature if you're an adult. And if it's greater than 100.4 degrees Fahrenheit, that's fever. Less than that, it's not a fever, so that's normal. But if you got 3 or more days of that, probably you should go to the ER just to make sure that whatever the immune system is fighting against, I mean, it's under control. That doesn't mean they're not going to do, I mean, they're going to do things. They might simply do a routine blood work and do not give you anything, but at least they will try to figure out if everything's under control. If you have traveled to tropical and subtropical countries, like I said before, because of course you have the chance to get one of those conditions, diseases like Zika, which is very, well, not common here in the US, but it is now. Everybody knows about it because it has been in the media. Or dengue fever or yellow fever, you could have it. So definitely in the past probably 20 or 25 days, if you travel to one of those countries, probably you should go to the ER and mention that, of course. If it's associated with any neurological symptoms like that you're feeling sleepy, or somebody, your family member that has the fever, it's difficult to wake up, it's always trying to sleep. If you're seeing things, you're hearing things, you have neck stiffness, that's another one, you should go to the ER, because neurological infections need to be treated as fast as possible. And it's very important for you to know that it's not acceptable to have any neurological symptoms. If you have febrile seizures, which are the seizures that are caused by fever, of course, you might want to go there. And there's something I want to explain about this, because there are certain myths about fever, that if you let your fever go more than certain degrees, it can damage your brain, or you can actually, people think that a fever causes meningitis, which is an infection in the central nervous system, or that it causes seizures. Well, those are myths. It's not how it works. I mean, there is a condition that is called febrile seizures, but many, I mean, very little patients have it, actually. It's only when you're between 3 and 5 years of age, maybe younger, but never past 6 years of age. So if you seize and you have a fever, that's considered a neurological symptom, so you should go to the ER also. And of course, the same old immunosuppression, you should go, definitely, because for immunosuppressed patients, there's a different threshold for what they call fever. So probably at 100 degrees, I will already be going to either the ER or at least your primary care, so he or she can run some tests to see what's happening. But if your fever is associated with common symptoms like runny nose or stuffy nose or sinus pressure or pain, or you have headaches or chills, which are very common, or it's associated with respiratory symptoms like cough or a low-grade fever, probably that's okay for you to stay home and try to do certain things first.